Madam President, I come to the floor today as someone who's practiced medicine in Casper, Wyoming for 25 years. As an orthopedic surgeon for the people of the great state of Wyoming, as well as the medical director of the Wyoming Health Fairs, a program that's outreach to people all across the Cowboy State with low-cost health care screenings, all aimed at giving people an opportunity to take more responsibility for their own health and essentially keep down the cost and get down the cost of their medical care. So today I come to the floor with a second opinion on what this Senate has passed, what the House has passed, and what has been signed into law by the President. And I come today because I continue to believe that what is now the law of the land when health care reform is going to be bad for patients, bad for providers, the nurses, the doctors, those who take care of our patients, and bad for payers, bad for the American people who end up paying the bill for health care in this country, the taxpayers of this nation, people that pay for their own care, because I believe fundamentally, as this bill has been passed into law, that it's going to result in higher costs for patients as well as for taxpayers, less access to care for people all across America, and unsustainable spending at a time when we're running record deficits. And that's not just my opinion. If you ask what the public believes in the polling across the country, the American people have overwhelmingly rejected this bill that is now signed into law by the President, rejected it because they believe that the cost of their own personal care is going to go up, the quality of their own personal care is going to go down, and that fundamentally they believe that this bill was not passed for them, but was passed for someone else. And the reason I come to the floor today to talk about it is because the report has just come out by the Centers for Medicare and Medicaid Services actuary, Richard Foster. He's the chief actuary, and he has come out with a report to go through methodically and page by page what's actually in the health care bill. You'll remember that when the bill was in front of the House, the Speaker of the House, Nancy Pelosi, said that you'll have to pass the bill before you get to find out what's in it. And in a rush by this body to pass a bill that to me was irresponsible, they've missed the things that now the actuary for the Centers for Medicare and Medicaid Services has outlined in a very thorough report to the American people. And I want to go through that with you, because fundamentally this says that health care costs are going to be higher. Access to care is going to go down. The spending is unsustainable. And it's fascinating because this is in light of a speech by President Obama in June of 2009, when he said if any bill arrives from Congress to his desk that is not controlling costs, that's not a bill I can support, he said. He said, it's going to have to control costs. Well, the actuary tells us that the bill now signed into law by the President, as well as the additional bill, because there are actually two new laws, one the initial bill and then the fix-it bill, they will increase costs, raise federal spending, threaten access to care for seniors, and will result in higher insurance premiums. Now, that's not a Republican senator saying that. That's the chief actuary for the United States in charge of Medicare and Medicaid in a well-documented report that is out April 22nd, 2010. Well, what's actually in the report? Let's go through it page by page. First thing is, it says this is going to bend the spending curve, the rate at which we're spending money on health care in the country. You know, the President said we want to get the bending cost curve down. This says just the opposite, Mr. President. The cost curve is going to go up. That's on page 2. Turn to page 4 of the report. We'll go through this page by page. What about overall national spending on health care over the next 10 years? Well, between 2010 and 2019, the national spending on health care is going to go up by $311 billion. Well, the President said he wanted a bill that was actually going to get the cost of care down and the spending on health care down. Let's turn to page 7. The president said that he wants to make sure that if you have care that you like, you can keep it. You can keep the care that you like. We all heard that. We heard it time and time again. But yet page 7 of this report by the president's agency says about 14 million people will lose their employer coverage by 2019. The President of the United States says if you'll have what you like, you can keep it. His actuary, who actually had to do the numbers of the bill, said, sorry, 14 million people are going to lose their employer coverage by 2019. Let's turn to page 8. An estimated 23 million people will remain uninsured by 2019. This is at a time when the president said he wanted to provide coverage for all of these people, but even 10 years out, 23 million people will still remain uninsured in the United States. Many of them are going to have to pay a penalty because of that. They will be fined because that's how the rule and that's how the law has been written. Well, I talked to a lot of seniors. I was home, Madam President, this past weekend in Wyoming, visiting with a number of seniors around the state. Was in Torrington, Wyoming, and Casper, and visiting with folks, and they're concerned about their Medicare. What does it say about Medicare? Turn to page 9. It's unsustainable. The cuts that we're looking at are going to become unsustainable even within the next 10 years. And yet the cuts to Medicare of over $500 billion, you know, you would think at a time when we're looking at more and more seniors coming of age to be on Medicare that we would have used that money, use that specific Medicare money and keep it in Medicare, use it to save Medicare, not to start an entirely new government program. So as we work your way through this, you say, well, what does it mean for these seniors on Medicare? And that gets to page 9 and page 10 of the national report, the Centers for Medicare and Medicaid Services. These are the people that know. They looked into the numbers. They basically said they didn't have time to do it while the Senate and House were rushing to pass a bill. Said, you know, we should have given some more time and more thought to this. But what happens when they actually look at what's been signed into law? Well, they talk about the cuts to providers, to the people that take care of the patients on Medicare. They're expecting many providers, medical professionals, it says, to, quote, end their participation in the program. This is going to jeopardize access to patient care. The report says 15% of all of the hospitals in this country, all of the nursing homes in this country, and similar providers, so we're talking about home health care agencies, that link, that lifeline to people that are at home needing care, to hospice, for people who are in the final days of their life, that about 15% of all of them, as a result of the way that this bill has been put together, are likely to be operating at a loss, at a financial loss by 2019. And then are they going to be able to stay open? Are they going to be able to provide care for people? Absolutely not. Are they going to close down? Very likely. And is that going to impact a lot of rural communities across this country? Absolutely. So as we go through this actuary report, it really brings to light when Nancy Pelosi says you're going to have to pass the bill before you get to find out what's in it. What a shame that is, that the American people, although they sensed they knew what was in it, really had to wait till this point so that they can then continue to express their concerns to those who voted in favor of it. Well, let's take a look at some other provisions. Those who supported this bill said there are other Medicare savings provisions in the bill that will help save money and that will help control future health care growth. Nope. The report, page 13, they said those things that people in this chamber said will help actually control future health care costs. Now it said negligible financial impact over the next 10 years. Negligible financial impact over the next 10 years, even though members of this Senate stood up on the other side of the aisle and absolutely swore that this is going to improve care as well as get down the cost of care. Now let's turn to page 15 of the report, the Class Act. That's the long-term care insurance program that so many in this chamber thought was going to be a wonderful thing, and those on my side of the aisle said, this can't work. the numbers are not going to work for our country. They're not going to work for this bill. Who are you trying to kid? Well, the Democrats who supported the Class Act weren't able to kid the people at Health and Human Services Division of Medicare and Medicaid. Oh no, they saw right through it. But of course, the report came out after the bill had been signed into law by the president. What the report says is that the Class Act faces, quote, a significant risk of failure. A significant risk of failure. It says there's a very serious risk that the Class Act program will be unsustainable. People on this side of the aisle said that. We said it before the vote. We heard from the other side of the aisle, oh no, you have it all wrong. People that looked at it and know, and these are the president's own people, they said unsustainable. Now, what about premiums for insurance? The president last year said he expects to lower the health care premiums for the average family in this country by $2,500. An incredibly admirable goal, something I think all Americans would support, because after all, the president early on said, my goal is to get down the cost of care. Clearly something he abandoned early on. Because what this says on page 17 of the report from the actuary is that the new laws, fees and excise taxes, higher drugs prices, devices prices, this is all going to result in higher insurance premiums for American families. The exact opposite of what the president promised. Now, let's go to page 16, because we talk about funds allocated for the new high-risk insurance pools. I think it's important to have these pools. They work well in various states. A number of states have these pools. It's a commitment by the state. We want to involve the federal government in that. Have people working together for folks with pre-existing conditions, people that absolutely need care. But what the CMS report said is that what this body has done is insufficient. It says that the amount of money they decided to put in this program is going to be exhausted by the year 2012. Exhausted by the year 2012. So once again, this body that said they knew better than the folks who really studied the bill, those who said we just have to pass it to get something done, I think have created a monster, and the American people are going to be paying the price for a long, long time. Well, let's look now to page 20. Because so many of the people that are going to be covered under this program, how are they going to be covered? The president said, I want to cover all these people. What he's decided to do, and what this body has decided to do, is to cram another 18 million people onto Medicaid, a program that we know right now is fundamentally flawed. It is broken. Half the doctors in the country don't want to see patients on Medicaid because the reimbursement to them is so low. Hospitals tell you that they lose money when those patients are in the hospital. Doctors will say they can't keep their offices even open if they take more and more Medicaid patients, and the only way they're allowed to see them is by charging other patients more, the cost shifting that happens in health care in America. Well, what does this say about Medicaid? It said, well, 18 million more people are going to be put onto Medicaid by the year 2019. So is that going to be care? Because the president talks about coverage, but he doesn't talk about care. These people are very unlikely to get care. When we talk about it, this is what the report says, page 20, a significant portion of the increased demand, for Medicaid services, because there's all these millions and millions of more people on Medicaid, increased demand for Medicaid services could be difficult to meet. So all these patients are going to be put on there, and they're not going to be able to get care. So I would say, Mr. President, it's hardly fair, and it's misleading to the American people. Everybody in Canada has coverage. They have coverage, but they can't get care. 33,000 Canadians came to the United States last year to pay for their own health care because even though they had coverage in Canada, they can't get care there, so they come to the United States and pay for care. And this Medicaid program, about a year ago when the President of the United States was talking about health care, he always held up the Mayo Clinic as the model for excellence of care in America, and it is a model for excellent care. The Mayo Clinic said, we don't need more Medicare patients. We don't want Medicaid patients because they lose too much money by taking care of those people, and they want to keep their doors open to fulfill their mission. So here you have, Mr. President, the actuary who is looking at this page by page, and this is somebody, obviously, the Centers for Medicare and Medicaid Services, knows what they're talking about, looked at the numbers, and item after item, page by page, says this isn't working. Now, one of the things that we talked about at the Health Care Summit was the issue of Medicare fraud. And I sat at the table and discussed the issue with the President. Now, this law does almost nothing to limit actual fraud and abuse. Last year, Medicare paid $47 billion in claims that are suspect. $47 billion. We know that in Florida, drug dealers have been moving from dealing in drugs to Medicare fraud. You say, why? Why would you do that? Well, they're doing it for a couple of reasons. One is it's more profitable. Two is it's less likely that they'll get caught. And third is if they do get caught, the penalty is less. So they're saying more profit, less chance of getting caught, less punishment. I think I should go into Medicare fraud, and that's what they're doing. So you're seeing this at a time. So what does the actuary say as they look at the new bill? They estimate that the fraud provision in the law will save only about 2%, only $1 out of every $50 of Medicare fraud. Now you look at this, and it's no surprise that the American people want a second opinion about this bill. It is no surprise that the American people are saying it's time to repeal and replace the bill. And that's why I come to the floor today of the Senate, Mr. President, with my second opinion from 25 years of practicing medicine. And you know, on the way over, I picked up USA Today, and it's so interesting. Big story in the paper today. Next phase in the health care war, applying the law. And the subheadline is Cabinet. We're talking about the President's Cabinet, the Cabinet of the United States. Cabinet braces for lobbying blitz by industry advocates. Cabinet is bracing for a lobbying blitz. Well, I thought the President of the United States said he didn't want lobbyists in the White House, didn't want lobbyists impacting on his cabinet. But, boy, they're weighing right in, absolutely. And the President did have them in the White House, obviously behind closed doors, cutting the deals. And that's the way, Mr. President, that we ended up with a health care bill that is bad for patients, bad for providers, and bad for payers, the American payers, the taxpayers of this country, and the people that are paying for their health care. And that's why, Mr. President, I come to the floor to say it is time to repeal this piece of legislation and replace it. Replace it with legislation that is actually patient-centered, that gives more responsibility and opportunities for individual patients. The thing I tried to do through the Wyoming Health Fairs, where we give people more information so they can use that information to get their cholesterol down, get their blood pressure under control, find out if they're diabetic, and if they are, get their blood sugar under control, give incentives to individuals to stay healthy and keep down the cost of their care. We need a patient-centered health care bill. We sure don't have one. We need a health care bill that allows people to buy insurance across state lines. That increased competition will drive down the cost of care. Mr. President, the University of Minnesota did a study. 12 million more Americans would have insurance today without this bill, if all we did was allow Americans to buy insurance across state lines and allow small groups to join together to get better opportunities to buying insurance to get the cost down. And then, of course, deal with the abusive lawsuits that exist in this country, which drive up the cost of care for patients because of all of the tests that doctors routinely order, not to help the patient get better, but to make sure the doctor doesn't miss something. So that's why I come here today to tell you, Mr. President, there are things that will work to get down the cost of care. There are things that will work to provide additional treatment for more people in America, more patients, better care, but they're not in this health care bill that passed the House, passed the Senate, signed into law by the President. And that's why today I offer you my second opinion, and the opinion is it is time to repeal this bill and replace it with things that will work. Thank you, Mr. President. I yield the floor and note the absence of a quorum.